Hi, my name is Samira, and our organization is the Children's Center. The Children's Center is located within Detroit at 79 West Alexandrine. The Children's Center is home to many specialized clinical services. They lead the way in working with children who struggle with behavioral, emotional, educational, intellectual, and developmental challenges or may have experienced trauma. They treat the whole child, looking at more than a single issue so they can provide the best, most comprehensive, integrated care. They examine barriers in the home, school, and community, working with the family who raises them and the organizations that support them. The Children's Center provides immediate walk-in care to children who are in non-medical crisis. They focus on helping families achieve safety and stability during and after a crisis, and they help heal families. The Children's Center was founded in 1929. In the late 1920s, children in the Detroit area who were abandoned, abused, or alone had little hope or chance of survival. United States Senator James Couzens felt a deep compassion for the plight of these children. In 1929, he helped establish the Children's Center, one of the first child guidance clinicals in the country. For the past century, the Children's Center has led the way in working with children struggling with mental and behavioral health challenges or experiencing trauma. The Crisis Care Center opened in February of 2012 and over the past 10 years has helped several children and their families in crisis. Throughout the 2018 to 2019 year, the Crisis Care Center helped 639 kids. The Crisis Center is currently open Monday through Friday from 8 a.m. to 8 p.m. The Children's Center mission is to help children and families shape their own futures. The purpose of this organization is to exist to improve the lives of children and families, which in turn will strengthen communities.
Hi, this is Mohammed Hamoud. Many children experience crises that create intense emotional, mental, and behavioral distress. The Children's Center Crisis Intervention Services are intended for cooling down and addressing life or behavioral issues. They provide mental health and safety assessments, crisis counseling and consultation by a trained therapist, interventions focused on keeping the family together, coordination with other service providers, linkage and coordination for ongoing services and community supports. The Crisis Center's goal is to resolve each crisis in a way that works the best to keep the child and the family safe. The Crisis Center is a wonderful resource for Metro Detroit families. If a child is in danger due to experiencing a crisis, such as intense anxiety, severe depression, thoughts of suicide or homicide, hearing voices or seeing things, causing distress or safety concerns, or poor impulse control, they should be taken to the Crisis Center. As a nurse, we should refer a child and their family to this resource if the child was experiencing any of these crisis situations and were in extreme danger. Families who are unable to financially cover medical expenses should also be recommended to the Children's Center. The Children's Center participates in several insurance plans, such as Molina Healthcare, Meridian, Blue Cross Blue Shield Blue Care Network, Priority Health, Beacon Health Options, HAP, United Healthcare Community Plan, United Healthcare, Blue Cross Blue Shield of Michigan, McLaren Health Plan, Blue Cross Complete of Michigan, Coventry Healthcare, Magellan Health, Total Healthcare, and TRICARE. The Children's Center asks monetary support from the community, which allows the Children's Center to meet the needs of children and families that exceed funding from public sources. Through donations, the Children's Center can keep services free and available to children and families who are unable to pay.
Hi, my name is Jennifer. And so you may be asking yourself, so why choose the Children's Center during a non-medical crisis for my child? Or you may be asking yourself, why does this resource benefit Detroit Metro families better than others do? So a child can experience an emotional crisis at any time. Many times, trauma and crisis happen during non-traditional office hours. So this will leave parents and guardians with very few resources and alternatives for care when it is needed most. Most people turn to hospital emergency rooms for care. Turning to the hospital emergency room for care for a child that is having emotional distress can be very costly. A child in crisis can be further stressed by long waits within the emergency room, which is also exposing that child to many other types of trauma cases, including physical and mental alignments. Many hospital emergency rooms are also not equipped to treat children who are having an emotional crisis. And with the average cost of a hospital stay being around $5,700, this is out of reach for many Detroit families. This is why the Children's Crisis Center is such a valuable resource for many Detroit families. The Children's Crisis Care Center gives parents and guardians a proper alternative that allows children to receive immediate and suitable mental health care. Children come into a calm and comfortable environment when they choose to visit the Crisis Center. They can stay with their parents and caregivers and build a relationship with the other professionals. The Crisis Care Center has directly lowered many inpatient visits at Detroit hospitals. The care provided at the Crisis Care Center is handled more efficiently with professional follow-up by caring staff specialized within the care and mental health of children. This is done by issuing a follow-up call to the child and the family within 24 hours of the Crisis Center visit, and by providing a plan in place for aftercare. Nothing is worse than when a child is in crisis, so the Crisis Center is there to help. Thank you for listening to our little presentation. If you guys have any questions, just leave us a comment. Thank you.